Welcome to Concept in Medicine. In today's tutorial, we are going to be talking about the Glasgow Coma Scale, which is a common tool used to objectively describe the extent of impaired consciousness in all types of acute medical and trauma patients, meaning that it can be used to grade the degree of an acute brain injury. The Glasgow Coma Scale tends to do that in three categories. It grades the patient using three categories. That is the eye opening, which has a total score of 4, the best verbal response, which has a total score of 5, and the best motor response, which has a total score of 6. And for the Glasgow Coma Scale, the total score will give you 15. So let's move ahead and look at the first component. The first component is the eye opening. The eye opening, as we said, it has a total score of 4. So a score of 6 would have no implication. A score of 5 too would have no implication. But a score of 4 means patient opens eyes spontaneously. You don't need to call the patient. You don't need to inflict any painful stimulus. The patient opens his or her eyes on his or her own. That is spontaneous opening of the eye. If the patient does that, you give a score of 4. The next one is a score of 3 for the eye opening. If the patient opens his or her eyes in response to voice, this can be done by mentioning the patient's name. And if you mention the patient's name and the patient opens his or her eyes, that becomes opening eyes in response to voice, and that you give a score of 3. A score of 2 is given if the patient opens eyes in response to painful stimulus. It means for that you could rub the sternum, where the patient would open the eyes in response to that. Pain we are talking about here is inflicted through the wrapping of the sternum. And if the patient opens eyes in response to that, you give a score of 2. That is opening eye in response to painful stimulus. And finally, if the patient does not open eyes at all in response to the painful stimulus, it means that would be no eye opening. And for that, you give a score of 1. For the Glasgow Coma Scale, for each component, the minimum score you can have is 1. Let's move ahead and look at the second component. That's the best verbal response. For the best verbal response, the total score is 5. So it means the score of 6 has no implication. A score of 5 means the patient is oriented in place, person, and time. If you ask the patient, where are you? The patient tells you, I'm in the hospital. If you ask the patient, who am I? The patient says, you are the doctor. Or you ask the patient what time it is. He looks through the window and say, it is evening, and truly it's evening. That means the patient is oriented in place, person, and time. And with that, you give a score of 5. The next one is patient is confused, and that can be detected through speech. He says something and it looks like a confused speech, and for that you give a score of 4. Then the next one, you give a score of 3 for the best verbal response if the patient gives or utters inappropriate words or speech. For inappropriate words or speech, you give a score of 3. A score of 2 is given if the sounds that the patient makes is incomprehensible. The patient makes a sound that you cannot comprehend, you cannot understand. Then finally, if the patient does not utter a word, then that becomes no verbal response. You give a score of 1, and that's the least that you can give. And let's look at the last component. That's the best motor response. The best motor response has a total score of 6. You give a score of 6 if patient obeys commands. Which commands? Lift your arm, it lifts the arm. Lift the other one, it lifts it. Lift the leg, it does that. Any command that you give, the patient does it, obeys it. You give a score of 6. The next one, you give a score of 5 if patient moves to localized pain. When we say moves to localized pain, it means that if should you be rubbing the sternum, patient's hand will be moving towards where you are rubbing, to move away, to push your hand away. That is moving to localized pain. And with that, we give a score of 5. The next one, a score of 4 is given if the patient withdraws from the pain. The patient moves the arms away from the pain. You give a score of 4. You give a score of 3 if there's an abnormal flexion in response to pain, and that abnormal flexion, we refer to that the decorticate posture, the decorticate posture. And what gives rise to the abnormal flexion? It tells you that the injury or the lesion is occurring above the red nucleus. And any injury that occurs above the red nucleus allows the red nucleus to overfunction. There is no contradictory or counter forces in place to counter the effect of the red nucleus. And the question is, what is the effect of the red nucleus? The function of the red nucleus is that it causes the disinhibition of the flexion response. And that means if you are disinhibiting something, it means you are actually enhancing that cause. So in short, the red nucleus enhances flexion response. So if there's a lesion above the red nucleus, it means that the red nucleus is free from any counter action from the upper centers. And that would make the patient to flex abnormally. And that would give what we call the decorticate posture. Should that be elicited, you give a score of 3. You give a score of 2 if there's an abnormal extension in response to pain. And that posture that is seen, we call it the decerebrate posture. And how does that come about? That will come about if the lesion is at the level of the red nucleus or below it. And in that, it inhibits the red nucleus. And if the red nucleus is inhibited, it means flexor or flexion response is also inhibited, causing the patient to lie in that abnormal extension posture, which we call the decerebrate posture. And finally, a score of 1 is given if there is no movement, if there is no motor response. And if you add the maximum scores, it will give you a score of 15. Let's move ahead and look at the interpretation of the Glasgow Coma Scale score. For a total score of 15 to 13, we will interpret that as a mild or minor traumatic brain injury. And if you are talking about a score of 12 to 9, we are looking at moderate traumatic brain injury. If you have a score of less than or equal to 8, it connotes to a severe traumatic brain injury or coma. But if you have a score of 3, that is the lowest you can ever obtain in a Glasgow Coma Scale. It refers to a deep coma. I believe we've learned something new today. But before we end the lesson, I have a question for you. The question is, why is it that during thoracocentesis, you are not advised to drain more than 1.5 liters of the fluid? Kindly leave your answers in the commentary section. Kindly make sure to subscribe to my channel, like, share, and also comment the next concept you would like to see in my next tutorial session. My name is Dr. Del, and this is Concept in Medicine. Bye-bye.